In the archives of medical obscura, the most baffling cases are not those where the body attacks itself, but where the mind orchestrates the body's destruction. A deception so profound it can lead a patient to the very edge of death, all in pursuit of a twisted, desperate goal. The year 1991 had just begun in a quiet Midwestern town. The festive cheer was gone, replaced by the whistling of a bitter winter wind. And then another sound cut through the night. The siren of an ambulance. At the local hospital's ICU, paramedics rushed in a young woman in her mid-20s. We'll call her Elsa. She was burning up, a fever of 106 degrees. Her blood pressure was crashing. She was in full-blown septic shock. Microscopic bacteria were rampaging through her bloodstream, and her body was losing the war. As the doctors furiously worked on her, they cut away her blouse. And what they saw underneath was a roadmap of past suffering, a latticework of scars from dozens of previous surgeries crisscrossed her body. Delirious from the fever, Elsa couldn't answer their questions. She couldn't remember the simplest details of her own life. The medical team knew they were in a race against time. If her temperature climbed just 2 more degrees, she would suffer permanent brain damage. From there, it would be a matter of minutes before her organs shut down completely. But during a brief, terrifying moment of lucidity, as she felt her life slipping away, Elsa knew something the doctors didn't. She had a secret. This catastrophic medical emergency was not an accident. And it wasn't the first time she had intentionally done this to herself. Elsa's secret places her at the center of one of medicine's most disturbing and least understood phenomenon: disease forgery. A condition where a patient will deliberately fake injuries or intentionally make themselves sick. The most infamous form of this behavior is a bizarre, compulsive disorder, once known as Munchausen Syndrome. Elsa was a veteran of the emergency room, but this time was different. This time, she was dying. Her organs were shutting down, starved of oxygen. The doctors worked for hours, pumping her full of powerful antibiotics, and finally, miraculously, they managed to stabilize her. But as she lay recovering in her hospital bed, her case file presented a deeply troubling puzzle. This was her first time in septic shock, but it was far from her first medical emergency. For the doctors who had treated her over the years, Elsa was a walking, breathing enigma. Her bizarre litany of symptoms had begun when she was just 18, a few months after she'd been in a serious car accident. First, it was mysterious stomach ulcers. Then, inexplicable bladder trauma. The ailments seemed unrelated to the crash, but they were just the beginning. Month after month, year after year, Elsa would return to the hospital, each time with a new and more baffling set of symptoms. She was a medical shapeshifter. Every time her doctors thought they were getting close to a diagnosis, she would suddenly develop a completely new malady that threw all their theories into chaos. She was an anomaly, a ghost in the medical system, plagued by one mysterious and unrelated disaster after another. She underwent countless diagnostic tests. She endured numerous invasive surgeries. But her doctors could never find a root cause. None of it made any logical sense. By the time she was in her early 20s, she had been hospitalized nearly 24 times. The physical toll was immense, but the toll on her life was even greater. She had to drop out of college multiple times. Without adequate insurance, she had amassed a staggering $400,000 in medical debt. She had no social life to speak of, and her parents seemed to be completely absent. Her doctors felt a profound sympathy for her. She was this tragic, isolated young woman suffering through so much with absolutely no support network. One physician in particular, an internal care specialist we'll call Jane, became very close with her. For years, Jane worked tirelessly, trying to connect the bizarre constellation of symptoms, desperately searching for the one single diagnosis that would explain everything. But the pieces would never fit. This last trip to the hospital, this brush with death, had changed something in Elsa. As she slowly recovered over the next few days, she felt an overwhelming compulsion to confess. She called for Dr. Jane, the one physician who had shown her true kindness, and she finally revealed her secret. All of it, every single illness, had been a lie, a forgery, self-inflicted. The confession was a litany of methodical self-destruction. She had boiled lead pipes and drunk the contaminated water to induce lead poisoning. She had poured corrosive drain cleaner into gelatin capsules and swallowed them like pills. She had even injected that same drain cleaner directly into her own bladder, causing such catastrophic, irreparable damage that she would be forced to urinate into a bag for the rest of her life. The list went on and on. Sometimes the deception was simpler. She would just pretend to have stomach pains to get admitted to the hospital. Once inside, she would secretly prick her finger and add drops of her own blood to her urine samples, creating false evidence to baffle her doctors and prolong her stay. She was an expert liar. She would meticulously research rare medical conditions and then carefully mimic their symptoms, feeding her unsuspecting physicians the exact clinical picture they were looking for. And they had accepted her stories at face value. Because why would anyone do this to themselves? This was exactly what Elsa wanted. To be a puzzle that could never be solved. Every time they got close to an answer, she would create a new symptom. But her compulsion was escalating. With each hospital visit, she had to go to greater and greater extremes to keep the doctors engaged. And this time, she had gone too far. This time, while already sick with the flu, Elsa had committed her most dangerous act of forgery yet. She had bought an insulin syringe and injected herself with fecal matter. The combination of the potent bacteria and the influenza virus had overwhelmed her system, bringing her closer to death than ever before. As Dr. Jane listened to this horrifying confession, her first thought was that Elsa must be suicidal. But Elsa flatly denied it. She didn't want to die. But she admitted she couldn't stop hurting herself. She had never told another living soul, terrified of being mocked or met with contempt. And Dr. Jane, true to her compassionate nature, was ready and willing to help. But the rest of the medical community was not. When word of Elsa's deception spread through the hospital, she became a pariah. Other doctors refused to see her. Even a psychiatrist turned her away, arguing that he couldn't possibly help a patient who would compulsively lie to him. Elsa had hoped that this brush with death, this gut-wrenching confession, would be her rock bottom, a wake-up call. Instead, it was just the beginning of a new, more desperate chapter. For the next few years, she continued to injure herself and lie about it. And now that her local doctors had blacklisted her, she had to go to even greater extremes, driving to other states, finding new hospitals and new doctors to deceive. She was trapped in a terrifying, self-destructive loop. She desperately needed someone who understood what she was going through, someone who wouldn't judge her. But that person didn't seem to exist. Then, one day, in a bookstore, she found it. A book by a psychiatrist named Dr. Mark Feldman, a world expert on disease forgery. And in its pages, Elsa finally found a name for her private hell: Munchausen Syndrome. Today, the condition is more formally known as factitious disorder imposed on self. It's a complex psychiatric disorder where a person deliberately fakes, exaggerates, or creates symptoms of an illness in themselves, often insisting on dangerous and unnecessary medical procedures. It is absolutely crucial to distinguish this from another form of medical deception known as malingering. A malingerer fakes an illness for a clear, tangible, external goal: to get prescription drugs, to win a lawsuit, or to collect disability checks. The motivation is simple and self-serving. But for someone with factitious disorder, the motivation is internal, psychological, and far more complex. Their behavior isn't driven by the pursuit of money or drugs. In fact, it's often the complete opposite. Elsa's actions weren't self-serving. They were self-destructive. They had led her to permanent physical damage, crippling debt, and profound isolation. She was gaining nothing, and yet she couldn't will herself to stop. This baffling, seemingly irrational behavior has perplexed doctors for centuries, ever since it was first formally described in 1836 by a Scottish doctor named Hector Gavin. While observing soldiers, he was the first to categorize these feigned and factitious diseases. But Gavin was largely uninterested in the why. He was a pragmatist. He assumed that most of his soldier patients were simply malingerers, faking an illness to get a ticket home from the front lines. He did allow that some patients might do it for more psychological reasons, to excite compassion, or for the simple, perverse gratification of successfully deceiving their superiors. But even these motives, in his eyes, were ultimately selfish. They were about getting something. Because Gavin's work faded into memory for nearly a century, the medical world would continue to view these patients not as sick, but as frauds. But that perspective began to change in 1934 with a groundbreaking paper by the influential American psychiatrist Dr. Carl Menninger. He outright rejected the simple theory that these patients were just selfish frauds. He had observed several patients who would risk their own lives for no obvious gain whatsoever. In Menninger's time, this was even more shocking. This was an era before modern diagnostic tools, an era before widespread antibiotics. Any surgery was a gamble with death. A minor procedure could easily lead to a life-threatening infection, sometimes even necessitating another amputation. Menninger was astonished that anyone would lie and manipulate their way into these dangerous operations. He was so struck by this compulsion that he gave it a name: polysurgical addiction. He couldn't find a rational explanation for it, so he proposed a revolutionary theory. He believed the behavior wasn't a conscious choice at all, but was pathological, stemming from the deep, powerful repression of unconscious desires. Repression is a psychological defense mechanism where a person involuntarily forgets a memory or emotion that is simply too painful to deal with. The memory isn't truly gone. It still resides in the unconscious mind, a hidden ghost influencing a person's behavior in ways they can't understand. Then, in 1951, a British physician named Richard Asher would give this strange disorder its unforgettable name. Asher was intrigued by patients whose dramatic symptoms consistently failed to show up on any physical test. A patient would complain of horrific stomach ulcers, but X-rays would come back completely clear. He also noticed another related trait. In addition to faking their illnesses, these patients told outlandish, dramatic, and easily disprovable lies about their lives. One man spun a heroic tale about his time as a prisoner of war, when, in reality, he had spent those years as a patient in another hospital. These patients, with their compulsive and fantastical lies, reminded Asher of a character from a book he'd loved as a child, The Surprising Adventures of Baron von Munchausen. The real-life Baron was an 18th-century German aristocrat, famous for regaling his guests with wild, unbelievable, and completely fabricated tales of his own bravery. Asher saw a direct parallel. He believed this compulsive lying, this pseudologia fantastica, was the very same behavior he was seeing in his patients. And so, to make the condition easier for other doctors to recognize, he named it after the fantastical Baron. He called it Munchausen Syndrome. But even as he gave it a name, the central mystery remained. Asher himself wrote that the most remarkable feature of the syndrome was its apparent senselessness. Experts like Dr. Mark Feldman emphasize a crucial point. Unlike a delusional patient who has lost touch with reality, patients with factitious disorder are typically fully aware of what they are doing, and they can be incredibly savvy at covering their tracks. This is why diagnosing the disorder is so incredibly difficult. It often feels less like a medical examination and more like a criminal investigation. Patients will deliberately create or fake symptoms that are almost impossible to disprove, like reporting a seizure that conveniently happened just before they arrived at the hospital, leaving no physical trace. And in the modern age, with the rise of online medical databases, they have access to all the information they need to perfectly mimic the symptoms of any disease they choose, making their deception nearly flawless. This puts doctors in an impossible moral dilemma. If they ignore a patient's reported symptoms, and they're wrong, the patient could die. But if they suspect a fake and confront the patient, they are often met with furious denial, aggression, and even the threat of a lawsuit. It's a perfect, vicious circle of deception. And all the while, The patients themselves are the biggest victims. Like Elsa, they can go bankrupt from unnecessary treatments. They lose their jobs, their friends, their entire lives. They have absolutely nothing to gain and everything to lose. And yet, they don't stop. The great unanswered question remains why? They have nothing to gain and everything to lose. And yet, they don't stop. The great unanswered question remains why? To find the answer, we must dig deeper into Elsa's past. Her destructive obsession began around 1985. At the time, she had no idea how far it would go. 6 years later, after her near-fatal septic shock, she confessed everything, hoping that bringing her secret into the light would force her to stop. It didn't. But then she found a book by the psychiatrist Dr. Mark Feldman. For the first time, she felt understood. She wrote to him, begging him to treat her. When he agreed, Elsa moved to Alabama, where he practiced. She knew this was her last chance. And if she wanted to get better, she had to be brutally honest. That meant finally telling the truth about her childhood. Elsa's childhood was not a typical one. It was forged in chaos. In the 1970s, when she was just in elementary school, she burned her family's house to the ground. She was involuntarily committed to a psychiatric facility, insisting to anyone who would listen that she hadn't meant to harm anyone. She claimed she had only done it to bring the family together. What that cryptic phrase truly meant is unclear, but we know that her home life was a battlefield. Her parents fought relentlessly. She grew up in a deeply dysfunctional, unstable environment, and modern psychology tells us that children who grow up in such chaos are at an extremely high risk for developing mental health conditions later in life. Elsa had hoped the psychiatric facility would be a refuge. Instead, it became a new kind of hell. During her stay, she suffered horrific new abuses, this time at the hands of the staff. She was tied up, beaten, punished, and humiliated. She was no longer a patient. She was a prisoner, locked away with sadistic guards. Then, one afternoon, while working in the facility's kitchen, Elsa had an idea, a desperate, dangerous idea. She accidentally spilled a corrosive oven cleaner on her arms and screamed for help. She was immediately rushed to the hospital's infirmary, and there, for the first time, she was safe. The nurses treated her with a kindness she had never known. For a little while, she was cared for. She had found a way to escape her abusers by injuring herself. So she kept at it. She drank juice secretly mixed with cleaning chemicals. It burned her esophagus and caused massive stomach pain, but Elsa didn't care. In the infirmary, she was treated like a patient, not a prisoner. And in her young, traumatized mind, a powerful and dangerous association was forged. Sickness equals survival. Years later, after she had stopped the self-harm, a terrible car accident landed her back in the hospital. And during that stay, something else clicked. The nurses sat at her bedside, talking with her, laughing with her, telling her everything was going to be okay. In their kindness, Elsa found something she had craved her entire life, the feeling of a loving family. In her own words, "I thought I had found heaven on earth." For the first time in her life, Elsa was experiencing something that most of us take for granted. Think back to a time when you were a sick child. Your parents took care of you, brought you soup, showered you with attention. In those moments, you felt safe. You felt loved. Elsa never had that. In her chaotic, dysfunctional childhood, she had never truly felt loved. And according to experts like Dr. Mark Feldman, this is a common thread among patients with factitious disorder. For them, the hospital is the only place they have ever experienced that kind of comfort and care. This phenomenon is explained by what is known as attachment theory. The theory states that our earliest relationships with our parents create a lifelong template for how we connect with others. We spend our entire lives unconsciously seeking to recreate that primary bond. In Elsa's case, her parents had failed to give her the unconditional love and support she desperately craved. So she began to seek it elsewhere, from the comforting authority figures she found in hospitals. The sympathy and care she received from her doctors and nurses became a powerful, intoxicating substitute. It was, in effect, a drug, and she would do anything to get more. "My goal in being sick," she later wrote, "was not to cause myself pain or create permanent injury. Those outcomes were just the necessary inconveniences along the road to my real destination, receiving that little bit of caring from the hospital staff. That would energize me and enable me to go on with my life." But the high she felt in the hospital never lasted. The moment she was released, she would be consumed by an overwhelming wave of shame and self-loathing. She hated what she was doing. She knew she was wasting precious medical resources that could have gone to people who were genuinely sick. This is a common, tragic paradox for people with factitious disorder. They are often acutely, painfully aware of the consequences of their actions. But something deep inside them just won't let them stop. In some cases, this guilt is twisted into a masochistic need for punishment. Patients with Munchausen often suffer from cripplingly low self-esteem. They make themselves sick because, on some level, they believe they deserve to suffer. This creates a horrifying feedback loop. The self-harm leads to guilt. The guilt lowers their self-esteem even further, which in turn creates a stronger need to punish themselves. In her memoir, another Munchausen patient named Andrea Abigail asked herself, "What kind of person would act this way?" Her answer, "Someone who deserves it." Like Elsa, Andrea's disorder was born from a horrendous childhood. She learned early on that getting sick or injuring herself was the only way to stop her father's sexual abuse, and the only way to get a sliver of attention from her indifferent mother. For her, just like for Elsa, sickness was the only time she ever felt loved. After one of her own children tragically died of cancer, she fell back into her old, destructive patterns. "I really do believe that factitious disorder is an addiction, like any other," Andrea later wrote. "I used illness as my substance to avoid the emotions that tormented me." Experts like Dr. Mark Feldman agree. The mechanics of factitious disorder are eerily similar to a behavioral addiction, like gambling. Every time Elsa or Andrea injured themselves and received that coveted rush of sympathy and care, their brains would release a powerful hit of dopamine, the feel-good neurotransmitter. The act of self-harm became inextricably linked with a feeling of pleasure and safety. But there's another, darker psychological mechanism at play. Both Elsa and Andrea described a strange feeling they would have when they were engaging in their self-destructive acts, a sense that they weren't in control, that they were a passenger in their own body, watching someone else take the wheel. This is a powerful defense mechanism known as dissociation. It's a way for the mind to disconnect from an experience that is too painful or traumatic to process. And for victims of severe childhood trauma, like Elsa and Andrea, it can become a deeply ingrained coping strategy. Every time they would injure themselves, they would enter a dissociative state. The rational part of their mind, the passenger, might have been screaming to stop, but the traumatized, addicted driver simply wouldn't listen. Elsa's story is a harrowing journey of self-destruction, a desperate search for care in a world that offered her none. Her actions hurt only herself. But this raises a much darker, more terrifying question. What happens when this disorder, this addiction to the sick role, is not imposed on oneself, but on another? June 15, 2015, Springfield, Missouri. A crowd gathers outside a small suburban home as a coroner wheels out the body of 48-year-old Dee Dee Blanchard. She has been brutally stabbed to death in her own bed. And her daughter, Gypsy, is missing. But Gypsy is not a suspect. She can't be. Everyone in town knew the sweet, frail 19-year-old. She was confined to a wheelchair, plagued by a laundry list of catastrophic illnesses, from epilepsy to cancer. But now, her wheelchair and all her medications are still inside the house. The police assume she's been kidnapped. The case becomes even more baffling when detectives trace Gypsy to Wisconsin. In the wake of her mother's murder, she has run off with her online boyfriend. Inside his home, police find cash and a bloody knife. But the strangest part of all? The frail, dying Gypsy Rose Blanchard appears to be perfectly healthy. During his interrogation, her boyfriend quickly confesses to the murder, but he insists he didn't do it for money. He says Dee Dee Blanchard deserved to die, and the person who asked him to do it, the person who helped him plan it, was Gypsy herself. The case of Gypsy Rose Blanchard pushes the boundaries of what we understand about medical deception. Last time, we followed the tragic story of Elsa, a woman trapped in the self-destructive cycle of Munchausen Syndrome, a disorder where a patient deliberately injures themselves to receive medical attention. But this week, we explore two even more disturbing evolutions of this disorder. The first, a terrifying form of abuse, where the deception is not turned inward, but outward. It's a condition where a caregiver, often a mother, will deliberately and systematically make their own child sick. It was once known as Munchausen by proxy. And the second, a uniquely modern mutation of the disorder, born from the anonymity and global reach of the digital age. A condition now known as Munchausen by Internet. Both of these disorders impact not just the patient, but everyone connected to them.
And, as we will see in the chilling case of Gypsy Blanchard, they can create a prison of lies so suffocating that murder can feel like the only escape. To understand how a supposedly crippled, terminally ill girl could orchestrate her own mother's murder, we have to go back to the very beginning.
To the birth of the lie. According to her mother, Dee Dee, Gypsy Rose Blanchard's medical troubles began when she was just 3 months old. Dee Dee claimed that the infant would periodically gasp for breath in her sleep, a potential sign of a dangerous condition called sleep apnea. The doctors, however, could find absolutely no evidence that Gypsy had the condition. They didn't believe any treatment was necessary. But Dee Dee felt otherwise. Convinced that she knew better than the experts, she took matters into her own hands. She bought a breathing machine and a heart monitor for the perfectly healthy infant. And she made sure everyone in the family knew that she, with her superior foresight and maternal instinct, had single-handedly saved her daughter's life. It was the first brick in a wall of deception that would grow for nearly 2 decades. The performance of the devoted, heroic mother had begun. 6 years later, Dee Dee escalated the drama. She informed Gypsy's father that their daughter had now developed epilepsy, a serious neurological disorder marked by unpredictable seizures. The claim was a bit strange, given that no one, except for Dee Dee herself, had ever actually witnessed Gypsy have a seizure. But then again, as she would argue, no one spent as much time with Gypsy as she did. Whenever Dee Dee brought Gypsy to the hospital, the doctors were perplexed. The little girl appeared perfectly healthy. But Dee Dee had chosen her phantom illness well. Seizures often leave no physical trace, and even a brain scan, an EEG, can miss the signs unless it's performed within a very narrow window of time. There was absolutely no evidence that Gypsy had epilepsy. But confronted with a frantic, desperate, and incredibly convincing mother, the doctors relented. Dee Dee's word was enough. A physician prescribed a powerful anticonvulsant drug called Tegretol. The drug had devastating side effects. It caused a severe overgrowth of Gypsy's gums, leading to chronic infections and decay. Over time, many of her teeth rotted away and had to be surgically removed. The lie was now permanently, physically etched onto Gypsy's body. And the medical problems, both real and imagined, only escalated from there. When Gypsy was 8, she had a minor fall from her grandfather's motorcycle. Soon after, Dee Dee claimed her daughter was having difficulty walking. She pushed for a muscle biopsy. And then, armed with this new evidence, Dee Dee wasted no time in announcing Gypsy's next and most terrifying diagnosis. Her daughter, she told everyone, had Duchenne muscular dystrophy, a rare and fatal genetic disease that causes the muscles to progressively waste away. Duchenne muscular dystrophy is a death sentence. Patients are typically wheelchair-bound by age 12 and rarely live past their early 20s. But Gypsy had no difficulty walking at all. Nevertheless, her mother ordered her into a wheelchair full-time. She was just being overly cautious, she would explain. But even as Gypsy supposedly got sicker and sicker, her father, Rod, noticed something strange. For a mother whose daughter was dying, Dee Dee seemed surprisingly calm, almost content.
Later that year, Dee Dee invented the next crisis. She claimed Gypsy had developed a severe reflux disorder that prevented her from eating solid food, pointing to the girl's low weight as proof. She began relentlessly lobbying doctors for a feeding tube, a device to be surgically inserted into Gypsy's stomach. The physicians didn't think it was necessary, but Dee Dee was a master manipulator. She booked appointment after appointment, begging, crying, insisting her daughter's life was at stake. And eventually, worn down by her sheer, overwhelming persistence, a doctor relented. By now, Gypsy was on a staggering cocktail of dozens of medications. One of them caused her to drool excessively. But Dee Dee didn't see this as a side effect. She insisted it was a symptom of yet another, new, serious medical condition. And with her chillingly effective powers of persuasion, she even convinced a surgeon to surgically remove her daughter's healthy salivary glands. How did she get away with it for so long? Dee Dee had created the perfect system of deception. She took Gypsy to countless different doctors and specialists, and because they rarely compared notes, she could control the entire narrative. She would arrive with a pre-packaged story of her daughter's many complex illnesses, and most doctors simply took her at her word. After all, why would a mother lie? It's possible some became suspicious. It was, statistically, almost impossible for one child to develop so many unrelated, chronic conditions, but they didn't speak up. Nobody wanted to risk offending this poor, devoted mother if they were wrong. Her own family saw her as a hero, the mother of the year. And if Dee Dee ever sensed that a doctor was beginning to have doubts, she would simply pack up and move, starting fresh in a new town with a new set of unsuspecting physicians. If anyone ever questioned her story, she had the ultimate proof: Gypsy's own body. The surgical scars, the missing teeth, the feeding tube. These were the physical trophies of her abuse, repurposed as evidence of her devotion. Even Gypsy herself was a silent accomplice. Before every single hospital visit, Dee Dee would coach her with two simple, unwavering rules. Say as little as possible, and don't move. And Gypsy, believing her mother was only trying to help her get better, obeyed without question. Of the 100 or more doctors who saw Gypsy over the years, only one ever truly dared to investigate. In 2007, a pediatric neurologist named Dr. Bernardo Flasterstein examined the then 12-year-old Gypsy. When Dee Dee mentioned the muscular dystrophy diagnosis, he immediately paused. The girl in front of him did not look like a Duchenne patient. Her leg muscles were firm and her reflexes were normal. The story didn't add up. So, Dr. Flasterstein did something no other doctor had done. He did his homework. He reviewed Gypsy's entire medical history. And he made a shocking discovery. Gypsy had been tested for the disease years earlier, and the results had come back completely negative. She had never been diagnosed at all. Dee Dee's story was a lie. Still not wanting to jump to conclusions, Flasterstein ran his own series of tests, including an MRI. They all confirmed his suspicions. Gypsy Rose Blanchard was perfectly healthy. When Dr. Flasterstein delivered the good news to Dee Dee, he expected she would be ecstatic. Her daughter wasn't dying of an incurable, fatal disease. Instead, Dee Dee became irate. She flew into a rage, cursing his incompetence, yelling that she would never come back. She grabbed Gypsy and stormed out of the office. Her reaction was startling and deeply revealing. For years, she had played the part of the devoted mother, caring for her desperately ill daughter. But the truth was, Gypsy wasn't the sick one. Dee Dee was, and her disease was about to become deadly. Dr. Flasterstein suspected Gypsy was the victim of a terrifying and insidious form of abuse. It was once called Munchausen by proxy. Today, it's known as factitious disorder imposed on another. Unlike the disorder that afflicted Elsa, where a patient harms themselves, the perpetrator here creates, fakes, or induces physical symptoms in someone else. The victim is almost always a child, and the perpetrator is almost always the mother. Dee Dee fit the profile perfectly. In her youth, she had briefly worked as a nurse's aide, giving her just enough medical knowledge to sound convincing when fooling Gypsy's doctors. And once she started down this path of deception, she couldn't stop. But to understand the why, we have to turn back the clock once more. Because Dee Dee wasn't just a perpetrator of this disorder. She was also a victim. In her own childhood, her mother, Emma, had treated her the same way. Emma would pretend Dee Dee was sick, isolating her from other children, claiming she had a deadly heart murmur. Dee Dee grew up believing that her fake illnesses were the only thing that made her special, the only thing that earned her love. When her mother died, all of that attention disappeared, and according to her family, Dee Dee went off the deep end. But when she gave birth to Gypsy, she finally found a way to get that sympathy, that attention, that feeling of importance back. She created a new identity for herself, the valiant, heroic mother who would do anything for her desperately sick child. And every time Dee Dee conjured a new, tragic diagnosis for her daughter, she got to be the hero. The feeling was intoxicating, a drug she couldn't live without. The local news ran stories about poor, sick Gypsy. The media attention reinforced Dee Dee's fantasy, and the fantasy came with very real benefits. Charities like Habitat for Humanity built them a custom house, rent-free. Gifts poured in from all over the country, free flights, a trip to Disney World, even a new car. To the outside world, and for a long time to Gypsy herself, this was all just proof that her devoted, overprotective mother was a living saint. But Dee Dee couldn't hide the truth from her daughter forever. As Gypsy entered her late teens, she began to have doubts. Small, nagging questions. Why did she need a wheelchair when she knew, secretly, that she could walk perfectly well? Why did she have a feeding tube when she was perfectly capable of eating the candy she would sneak behind her mother's back? Then, in 2011, she found the smoking gun. Hidden in an old shoebox, she discovered her own Medicaid card, and on it, a shocking piece of information. Dee Dee had always told Gypsy she was 15 years old. But the card listed her real birthday. Gypsy wasn't 15. She was 19.
Her mother had stolen 4 years of her life. Gypsy didn't understand the full extent of the deception, not yet. But in that moment, she understood one thing with perfect clarity. She had been betrayed. And so, she ran away. Her escape didn't last long. Dee Dee tracked her down and dragged her back to their pink prison. And the punishment was brutal.
Dee Dee took a hammer and systematically smashed Gypsy's computer to pieces, warning her daughter that the next time it would be her fingers. Then she chained Gypsy to the bed for 2 weeks. For Dee Dee, this wasn't just about control. The sick child was her lifeline, her only source of the attention and sympathy she craved. She could not and would not loosen her grip. For Gypsy, the picture was now becoming clearer. While she still believed she was genuinely sick with many of the diseases her mother had invented, she now knew one thing for sure. Her mother wanted her to stay sick, and she was trapped. Her lifetime of fabricated illnesses had left her totally isolated, with no friends to turn to. So in 2012, she turned to the only place she could, the Internet. On a Christian dating site, she met a young man named Nicholas Gojon. And to him, she confessed everything. She told him about her mother, about the prison of her life. And she told him that they could never truly be together, as long as her mother was still alive. 3 years later, on the night of June 10, 2015, Gypsy Rose Blanchard made her final move. She left the front door to her house unlocked. She placed a pair of gloves and a large hunting knife on the floor. And then, she went into the bathroom to hide and waited for Nicholas to arrive. Nicholas Gojon crept into Dee Dee's bedroom and fatally stabbed her 17 times. Gypsy had finally freed herself, but her freedom was short-lived. Following their arrest, both she and Nicholas were charged with first-degree murder. It was only then, during her own trial, that Gypsy Rose Blanchard finally learned the full, staggering extent of her mother's deception. Her defense attorney dug through mountains of medical records from dozens of different physicians, and there, in black and white, was the truth. The muscular dystrophy, the epilepsy, the leukemia. It was all a lie. Every single diagnosis was a fabrication. In light of the unimaginable abuse she had suffered, the state of Missouri reduced Gypsy's charge to second-degree murder. She was sentenced to 10 years in prison. Her boyfriend, Nicholas, received a sentence of life without parole. While in prison, Gypsy's health has improved dramatically, but she will forever bear the physical scars of her mother's disease. Her salivary glands are gone. Her teeth will never grow back. And yet, by orchestrating her mother's murder, Gypsy may have, in the most tragic way imaginable, saved her own life. Studies suggest that up to 30% of severe Munchausen by proxy cases are fatal for the victim. Dee Dee's addiction to the sick role would have, eventually, killed her daughter. It's a chilling reminder that this disorder, this disease forgery, is not just a bizarre psychological curiosity. It is an insidious and often deadly form of abuse. Munchausen by proxy is one of the most dangerous forms of this disorder. But in the 21st century, a new, startlingly common mutation has emerged, one that allows the deception to go global. Munchausen by Internet. A striking example comes from a woman we'll call Kristen. At 36, she was diagnosed with a virulent, metastatic breast cancer. Living far from her family, she turned to the Internet for support, joining online cancer groups and starting a blog to document her grueling journey through surgery and chemotherapy. She found a community, and in that community, she found a new friend. A 19-year-old girl we'll call Megan. Megan reached out to Kristen, sharing a story of unimaginable tragedy. She claimed she had contracted HIV as a child and was now also battling cancer. She hinted that her mother was abusive. And she came with proof. She sent Kristen photos of herself in hospital beds, hooked up to oxygen tanks, seemingly in the middle of treatment. Another mutual friend from the online community even vouched for her, saying they had met in person. Between the heartbreaking story, the friend's testimony, and the photographic evidence, Kristen had absolutely no reason to doubt her. She saw a fellow warrior in the fight for life and opened her heart to her. Kristen offered her new friend comfort and support, but the relationship quickly became parasitic. Megan was extraordinarily needy, a constant cycle of dramatic emergencies and miraculous recoveries. Caring for her was emotionally exhausting. Even just hours after her own mastectomy, Kristen found herself on a Skype call, comforting the girl she believed was dying. Then, one day, Kristen received one of the strangest calls of her life. It was supposedly Megan's mother, claiming her daughter was back in the hospital, perhaps for the last time. But as the woman spoke, a chill ran down Kristen's spine. Something was terribly wrong. The mother's voice was identical to Megan's. Remembering Megan's hints about an abusive home, Kristen feared the worst and called the police, asking them to perform a welfare check. The officer's report was short and brutal. Megan wasn't in the hospital. She wasn't sick. None of it was real. It had all been a lie. Megan was soon diagnosed with factitious disorder. She craved the same drug as Dee Dee Blanchard, attention and sympathy. But her method was new. She didn't need to poison herself or anyone else. For the modern Munchausen patient, the Internet had become the perfect stage. A place where simply faking an illness, with a few stolen photos and a convincing story, was enough. This is Munchausen by Internet, and experts like Dr. Feldman believe it may now be the most common form of factitious disorder. The web is the perfect ecosystem for this kind of deception. It allows a person to remain completely anonymous. It allows them to deceive a large, global audience at once. And the explosion of online support groups provides an endless, easily accessible supply of sympathetic ears. It's a nearly perfect crime. Unlike in the real world, online users can't check medical records or speak to a patient's family. Catching a liar, as Kristen did, is extremely rare. After she was unmasked, Megan wrote a public apology to the community she had deceived. Her confession is a heartbreaking window into the mind of a patient with this disorder. "I was attention-hungry, and I hated myself," she wrote. "I lied almost compulsively and am addicted to being loved, admired, and doted on. I have a history of self-harm and alcohol abuse. Those, added together, resulted in a bottomless pit who needed constant attention and validation. By accepting she had a problem, Megan took the first, crucial step toward recovery. But for many patients, this step is nearly impossible. Like Dee Dee Blanchard, they have built their entire identity around their lies. And when that lie is questioned, it doesn't feel like a diagnosis. It feels like a personal attack. And even when a patient is ready to seek help, the path is incredibly difficult. Manipulating doctors is a core feature of the disorder. As a result, many psychologists are extremely hesitant to take on a patient who they know will compulsively lie to them. But it's not impossible. One doctor found a way. Andrea Abigail, the Munchausen patient whose disorder was born from childhood abuse, finally sought therapy in 2002. But like many patients, she was still in deep denial. She told her therapist, Dr. Thomas Hall, that she needed help with an eating disorder, hiding the much darker truth of her self-inflicted illnesses. As Dr. Hall treated her for the wrong condition, her behavior became more and more erratic. He grew suspicious. During one session, she even brought a razor blade and threatened to cut herself in front of him. Dr. Hall considered dropping her as a patient, feeling completely unequipped to handle her complex issues. Then, her behavior escalated into direct threats of suicide. Scared for her life, Dr. Hall made the difficult decision to break her trust. He called 911 and had her involuntarily hospitalized. At first, Andrea was furious. She saw it as a betrayal. But deep down, she understood. He hadn't acted as her friend. He had acted as her doctor. And he may have been the only person who could truly help her get better. 2 weeks later, Andrea told Dr. Hall everything. He formally diagnosed her with Munchausen Syndrome and theorized that her condition stemmed from a deep-seated, profound feeling of worthlessness. The core of her recovery, he explained, would be learning that love was something she deserved, not something she had to earn through pain and suffering. Dr. Hall treated her disorder exactly like a substance addiction. He encouraged her to confess everything to her husband. He even drafted a recovery contract, a promise she made to herself and her loved ones that she would no longer hurt herself. But it wasn't that simple. She broke the contract within weeks. Progress from Munchausen patients is agonizingly slow, and relapse is common. There are no easy cures. Dr. Hall worked with Andrea relentlessly, helping her identify the roots of her feelings of worthlessness. He used complex therapeutic methods to help her rebuild her entire sense of self. For her entire life, Andrea's identity had been completely tied to being sick. It was the only way she felt she could get love. Through years of intensive therapy, she slowly learned to see herself differently, as a mother, as a wife, as a student. She began to recognize, for the first time, that she deserved love for who she truly was, not for the illnesses she could create. Andrea's treatment took years. It was a brutal process of 1 step forward, 2 steps back. But her fear of losing her family motivated her to keep fighting. Over time, her trips to the hospital became less frequent. And then, finally, they stopped altogether. After years of work, she was finally free. Dr. Hall's intensive therapy-based approach is one way to treat this disorder, but it's not the only one. Other experts, like Dr. Mark Feldman, suggest a more behavioral tactic, replacing the harmful, attention-seeking behavior with a positive one. Instead of making themselves sick to get a response, patients are encouraged to go for a run or learn a new skill, and then post about that positive accomplishment on social media. The goal is to slowly, methodically, retrain the brain to associate praise and affection with self-care rather than self-harm. These stories show that for patients who harm themselves, like Elsa, Andrea, and Megan, recovery is possible. It's a long, difficult road, but they are not a lost cause. But this philosophy of healing and support becomes far more complicated when the patient is not the victim, but the perpetrator. When the patient is someone like Dee Dee Blanchard. In fact, there is a fierce debate over whether Munchausen by proxy should even be considered a mental illness at all. Many experts, including Dr. Feldman, believe that Munchausen by proxy belongs firmly in the legal category of medical child abuse. They argue that when a parent systematically harms their child, the solution isn't therapy, it's prison. Under this view, a doctor who suspects Munchausen by proxy has a legal and moral obligation to report it to Child Protective Services. The parent's own path to recovery takes a back seat to a criminal investigation. Their illness becomes a matter for the courts, not the clinic. And unfortunately, court-ordered therapy for these perpetrators has proven to be notoriously ineffective. The biggest problem with all factitious disorders is that they remain so wildly misunderstood. The patient's actions, their lies, their manipulations, can undermine our deepest instincts of trust and compassion. But their struggles, born from trauma and a desperate need to feel loved, are still tragically real. They are victims of their own minds. Factitious disorder stems from the fundamental human desire to be needed, wanted, and accepted. It is, in its purest form, an addiction to affection. And in the end, love can be the most potent and most dangerous drug of all.